Hello, welcome to this edition of The Wise Owl. I'm your host, Scott Turner, and this is a series of videos where I have the opportunity to interview my colleagues in the Department of Behavioral and Social Sciences at the University of Montevallo. And today I have the pleasure of interviewing Dr. Melissa Shepard, who is an assistant professor of psychology who earned her PhD in social psychology from Florida State University, and will be chatting with us today on the general subject of health psychology. And Melissa, one of the joys that I find about working in the Department of Behavioral and Social Sciences is I get to learn a lot from my colleagues in other fields. And off the top of my head, I can't say that I know very much about the subject of health psychology. So I'm just going to ask you an open-ended question. What's this all about?
Yeah, so health psychology is definitely a burgeoning field. So I technically am considered a social personality health psychologist. And like you said, my PhD was in social psychology. So I use those, the principles and theories in that discipline and then apply it to understanding health behaviors, people's ideas about illness, designing interventions to try to help people engage in more health behaviors. So the field really started probably in the 80s. So after the popularity of the biopsychosocial model of health. So previously when we thought about health, people were just thinking about like biological processes, like you come in contact with some kind of virus and then you become ill. And then there was a lot more data coming out saying that it's a lot more of a complex system than that, other than just you're exposed to a virus. So for instance, I think one of my favorite experiments that demonstrates this is Sheldon Cohen is a health psychologist, and he does this cool research where he exposes people to cold viruses, and he puts them up in a hotel type of motel type situation so that they're not going around and affecting other people potentially. And they live there, and during that time period, data is collected about their illness, and they actually collect all of their tissues to weigh to see how much mucus they were producing during that time period. And the interesting thing is that it's not just so simple as some people who are exposed to the virus become ill. Other factors play a role too. So if you are stressed, then people are more likely to develop the illness when they are exposed to the virus compared to people who aren't. Similarly, people who are lonely, who don't have as much social contact, also we see are more likely to contract that illness. So anyways, we have a lot of data saying it's not just biological processes that lead to illness. Psychology matters. So we know that people who are stressed, like I mentioned, might be more likely to develop illnesses. There is data that vaccines, your immune system tends to not have as much a robust response to a vaccine if you are depressed or lonely or stressed. So psychology matters. People who have psychological disorders are also less likely to engage in health promotion behaviors like taking medications or exercising or eating healthy foods, those sorts of things. We also know that being a target of prejudice or discrimination can also affect your health. That people who are targets of prejudice tend to have worse health, particularly for cardiovascular disease. That children who are live in home environments that aren't the best, that are sort of not safe or just not children who are not well cared for, that puts them at risk for developing illness in adulthood, especially cardiovascular disease again. So anyways, I could just go through a list of random examples, but just to say that we know that psychology matters in terms of developing illnesses. So that's a big focus of health psychology, is doing research to investigate those links. And then there's a real large emphasis on health promotion. So how do we get people to live healthier lives? So there's data that suggests that around 40% of early deaths, so those are deaths before you would anticipate, can be attributed to behaviors. So smoking obviously is a real big one that contributes to lung cancer, a host of other cancers, cardiovascular disease, but other behaviors too, right? Like not eating a healthy diet, not getting enough physical activity in, that those could put you at higher risk for certain illnesses. So one big emphasis is trying to figure out, how do we get people to engage in healthier behaviors? So people do this through lots of different methods. I just saw a paper that was looking at, could bots that talk to people about the COVID vaccine increase their intentions to get vaccinated? And they find that actually that could be an effective strategy. So that's just one example of an idea of trying to get people, try to target people's behavior. Yeah, so my past research that has looked at this has really focused on health messaging, like the words and phrases, how you present information, and how that can have an influence on people's actual behavior, whether that be their calcium consumption, flossing, HPV vaccination has been a real interest of mine. Yeah, so lots of research on health promotion behaviors. And then there also is area that looks at how do we help people once they are ill. So that can be obviously very distressing. So there can definitely be some psychological sort of side effects if you're diagnosed with illnesses like cancer or some kind of chronic illness. So some people target that area. That is not my area. That tends to be more people who are trained clinically. And that is not, social psychologists are not trained in that capacity. So I hope that answers a little bit of your question about what health psychology is a field.
Well, as you spoke, numerous questions are popping into my head.
Mm-hmm.
You know, the first thing I think about, you know, we're filming this in the middle of a historic pandemic, and we know that, you know, upwards, I think, over more than a third of the U.S. population has yet to receive a COVID vaccine. And of course, we get into an intersection with political psychology, which is a subfield of political science. Is it early? Do we yet have any actual research to help us understand why there is so much vaccine resistance? And are there any specific tools that have been identified for, you know, trying to, I guess, persuade people to do what's best for them?
Yeah. So certainly you're right, because this is a new situation we're in. There is less research currently published, you know, compared to previous instances, but there is new research being published all the time. So I actually looked at some of this, but I thought we might look at this. So I think a couple of things. Oh, I mentioned the chatbot one already. One looked at people's intentions to be vaccinated. So I will say it didn't look at actual vaccine behavior, which in health psychology, the ideal is to study the actual behavior, not just intentions, because there's something called the intention behavior gap, which means intentions don't always perfectly align with your behavior, which all of us know. Sometimes I have the best intentions to work out a particular day, and I don't for a myriad of reasons. So they just looked at intention, and they were trying to figure out what would make people be more interested in it. And so they looked at whether or not public figures like famous, like scientists, other public figures, whether they be celebrities, religious figures, political figures, that if they learned that those people had been vaccinated, if that would increase their intentions. And indeed, they actually did see that. So that's good news, that public figures who mention their vaccination status could be beneficial.
So just modeling behavior, like prominent
Yes.
people.
Mm-hmm. And we know that from a lot of other research in terms of norms. So when there's a social norm for behavior, people are much more likely to conform. And so, yeah, they've done this a lot in health psychology. Like if you tell people that more people have gotten some kind of cancer screening, people are more likely to be interested in it. Yeah, so norms matter. The people you have contact with matter too. So if you know that people like your friends and family are vaccinated, that can increase intentions to be vaccinated. Yeah, so this is definitely something, there's more research coming out on how do we get people to be vaccinated. There, in terms of like HPV vaccination research, the biggest predictor for HPV vaccination is, has your doctor talked to you or your healthcare provider suggested and encouraged you to get vaccinated? So I haven't seen research on this specifically. It doesn't mean that it's not out there, but I would suppose that people who have been personally recommended the vaccine by their physician would probably have higher vaccination rates than people who are just recommended broadly by other public health officials. Yeah, I would say there's probably more research currently on earlier in the pandemic, before the vaccine was available, of who was engaging in more preventative behaviors like staying at home, those sorts of things. So there was an interesting paper that looked at personality and how that affected those behaviors. And this is not a shocker that people who were extroverted were more likely to be out and about and not staying home.
That probably explains why I've remained healthy throughout the pandemic, because
and all of the other personality factors actually predicted the higher likelihood of staying home. So people who were high in agreeableness, high in openness to experience, high in conscientiousness, and high in neuroticism were all people who were higher in those traits were more likely to stay home. And this was data earlier in the pandemic. I have a paper published with one of my good friends and colleagues, Stacy Mahanova. She's at the University of Arkansas. And we did a paper we collected data in March. So March of 2020, looking at the behaviors that people were engaging in. Were they staying home? Were they ordering their groceries out? Or if they were going out, were they using hand sanitizer, those sorts of things. And we did find a relationship between this idea of pathogen avoidance, that some people are higher in pathogen avoidance, and that those people were more likely to be taking some of those protective health measures. It is a sort of exciting time for scientists that you can test a lot of theories and ideas using the pandemic. So that paper, we're like, we got to get on this immediately and collect these data right even before lockdowns were starting in most places in the United States.
Let me ask you about a totally different behavioral matter, alcohol consumption, because I know, until a few years ago, I would see numerous media reports about the health benefits of alcohol consumption. And, I literally remember seeing an article that more or less said the more the better.
Yeah.
And then about 5 years ago, I know there was this big mega data study that metadata, I should say, I guess, that came out that said the complete opposite, that
Mhm.
it's not a healthy thing and you should really minimize alcohol consumption. What's your what's your knowledge of the latest data on that?
Yeah, so I think the line that most health psychologists have is that we would never suggest people start consuming alcohol in order to get any kind of health benefits, because although there might be some health benefits, they tend to be small, that they tend to be applicable for certain populations, that you don't really see the health benefits until middle age, for instance. So there's no need for people to start consuming alcohol earlier to get benefits. And again, that the benefit that you might get from antioxidants or whatever, you could get in other ways by eating a diet that's high in fruits and vegetables. That's one of the biggest, I think, health recommendations that health psychologists want to promote, is getting people to eat more fruits and vegetables in their diet, because those are so good for you in terms of different antioxidants and things. So yeah, I think the sort of line is that we wouldn't suggest it as a health promotion behavior, because we'd rather you exercise, eat fruits and vegetables, get enough sleep. That if you're a person who likes to partake in alcohol, then that can be probably fine in moderation, because really for men, like one drink a day, for women, like half a drink a day. And that in terms of a moderate amount of alcohol consumption is probably fine. But again, we don't really want to promote it because there's other ways you can get those same benefits. And then also, obviously, there is a concern for people having alcohol use disorders. And so, that's another reason we wouldn't really want to promote it specifically, because of that is certainly a risk. And again, you're talking about how much is too much. From some things I've seen, it can be a very fine line in terms of what is protective versus what now has gone into a risk factor. So I think I saw one study that looked at the relationship between alcohol and breast cancer in women, and that like half a drink a day was fine, but then women consuming 1.5 drinks are at increased risk. So again, that line is very thin between maybe offering some health benefits versus being risky for your health.
I'm curious, have you seen any research, because you keep quoting like one drink a day or half a drink a day, but I think a lot of people don't they're weekend drinkers, right?
Yes. Yeah.
So do you know if there's research on, or are we talking, can you like save them up for the weekend and like catch
Well,
up?
yeah. So no, because we generally don't want people binge drinking either,
Yeah.
which is consuming a large number of drinks in one time period, one sort of setting. For women, that's 4 or more drinks in a setting, and then for men, that's 5 or more drinks. That is also associated with health risks. But I haven't seen data on sort of spacing, like could you have 2 on the weekend versus doing like half a drink a day or whatever. But that would be interesting. There's probably research out there, but alcohol use isn't my area of specialty, so I don't
Yeah.
keep up
So
with it as
going
much.
back to just you mentioned stress, and I know this is something that might be relevant for students, because I remember my daughter's first semester in college. She was like sick the whole semester.
Mhm,
And it had an effect on her performance that first semester.
mhm,
And um, you know, I know, like, students, they live together in dorms and interact socially a lot, so there's a lot of opportunity for infection to spread. But there's also just a lot of stress for young people. And I guess I'm just asking an open-ended question about how all of this applies to student life.
Yeah, so certainly, if you think back to the H1N1 pandemic, which was in 2009, I believe, that one we saw, pretty high rates of spread on college campuses because people were living in close proximity, and that's also, a concern with meningitis. That's why college students need to be vaccinated against meningitis, as people are sharing close proximity. Yeah, so this is certainly, a cause for concern, that college tends to be a time where people are stressed out, that we know if you're moving away from home, you now have unique responsibilities that maybe you didn't have before. You might have some roommate drama, stress in terms of performing well in your classes. Yeah, so I think, especially in my health psychology class, stress is such a big deal that we actually cover 2 different chapters regarding stress. And so, yeah, I think really highlighting the need to figure out stress management techniques that are going to be helpful to try to mitigate some of the relationship between stress and illness. So that's one thing, is working on adding in some stress management techniques, whether that be some kind of relaxation training, whether that be something like gratitude. Daily gratitude is shown to be beneficial, whether that be something more formal like cognitive behavioral therapy. So working on the stress management technique that's going to be helpful for you, and then also making sure that you're doing other health behaviors that we know are helpful for the immune system. So sleep is a real big one that college students tend to ignore. That people are just like, oh, I'll just stay up late and work on this final. And we have lots of issues for that. One, because it's not good for your learning to stay up late. And then 2, in terms of, we know that sleep is so crucial for your immune system. So if you're not getting good sleep, it really, really weakens your immune system. So getting enough sleep. And in terms of sleep recommendation, a recommendation is to have a regular sleep schedule. That's another thing that college students have difficulty with, is on the weekend you might want to party or stay up and hang up, be up late, and then Saturday or Sunday sleep in, and then think, well, I sort of, I got my hours, but really that can throw you off for the rest of the week in terms of keeping that schedule and sort of helping yourself make sure you're going to be able to get those 7 hours of sleep. That when you alter your sleep schedule sort of different days, it's really hard to be successful in doing that. So I would say sleep, of course, eating your fruits and vegetables, but also I also want to highlight the benefits of exercise. There was a cool study done, I think by Brown in 1991. Don't quote me on that, but the researcher looked at stress in college students and whether or not they got ill. They actually looked at whether or not they had gone to the student health center, I believe, or maybe that might be confusing. They might have also looked at health symptoms. Anyways, regardless, they looked at health as the dependent variable, and they looked at the amount of exercise people were doing. So they found that people who were stressed and who were exercising regularly, they didn't see the impact of stress on their health, that you only saw that amongst people who were not exercising. So that can be another thing that you can do to sort of offset stress that you might be experiencing in college.
I know that's interesting to say that, because I know that some years ago when I was, I guess, around 40 or so, I started experiencing some mild panic attacks. And and it's around then that I started running pretty seriously.
Mm-hmm.
And just anecdotally, I would tell anyone, because since that time, I'm very rarely physically sick,
Mm-hmm.
and I think I have better mental health too, just positive attitude.
There is really good research on that physical exercise is really beneficial for mental health. And so, yeah, that is definitely a recommendation as well. That certainly if your mental health is not the best, it can make it hard to do health behaviors like exercise. But it definitely seems like in terms of the opposite direction, engaging in regular physical activity tends to be really good for people's mental health. Yeah.
What about relationships? I heard research that there's evidence that like religious faith or practice seems to have positive health benefits. And certainly one aspect of that is just like having community.
Yes. Yeah. So there's certainly some good data for health benefits for people who are more religious. And like you were mentioning, it's probably due to having more community. So having more social contacts. And in terms of and social support too, right? Because that's the thing of like, just because you know a lot of people doesn't mean that they're going to be providing you with social support. But perhaps in those contexts, that is a situation where people might be able to provide you with more social support. So that certainly is beneficial. And then also, many religions promote some of the things like we mentioned earlier, like being grateful, to not maybe focus on stressful events so much. And then, some religions also will promote, lower rates of alcohol use or no alcohol use at all. And so that could be beneficial. Yeah.
So this doesn't work for Episcopalians, right?
That would just be one aspect. Yeah. I was going to mention something I just thought, circling back to the topics we mentioned earlier, which was alcohol use and COVID. There has been research that people's alcohol use has increased during the COVID pandemic. So there are some participants that are just in ongoing longitudinal research studies, and they just follow their alcohol use over time. And they saw that alcohol use certainly increased during the pandemic. And then also other measures, if you look at alcohol sales, they increased as well. So anyways, lots of data that alcohol use is increasing during the pandemic. So that's sort of an indicator that people were probably not coping very well with the stress that they were experiencing, because we know that that tends to be a big reason for people's alcohol use. Is if you're experiencing stressful events, that can really affect alcohol use. And then the concern with that too is that alcohol affects your immune function and can weaken your immune functioning. So obviously, that's not what we want to see during a time like this pandemic. So anyways, I just thought of that some of that research that you might find interesting.
And I've also heard that alcohol, like drinking with food, you tend to eat more. I don't know if you've heard that.
Oh, I haven't heard that. Yeah,
Okay.
I'd have to look into that. Yeah,
look it up. But if that's true, then that could also contribute. That could be an add-on effect. If you're eating more and
people eat more when they're drinking.
That's what I'm saying. Yeah.
Oh, I was thinking that you were licensed to eat more, that you could consume more calories when you're drinking. Yeah, I mean, and that is part of the social inhibition. That when alcohol is a depressant. And so what happens as a result of that is that we are likely to do things that we wouldn't otherwise do, hence people dancing on tables. And for many people are sort of restrictive with their food, or they try to have control over the things that they're consuming. So certainly when you're drinking, then that can reduce people's self-control and ability to control that.
Yeah, I just imagined it more like, you're kind of sitting at a table with the wine flowing freely, and, you just kind of keep the meal going for another 30 minutes or so.
Yeah.
But,
that's what's happening too.
So, all right, let me kind of bring this to maybe a philosophical conclusion, which is, the relationship between health and happiness. Right? I mean, because if you only discuss health, that's sort of mechanistic, right? It's like keep these bodies
Yeah.
churning, right? But I assume there's probably research to show that healthier people are happier people.
Yes. And I will say that's the goal of health psychology, is to think really holistically about these things, again, versus just like, oh, this virus causes this illness.
Yeah.
To see like that these things tend to be very, very interconnected. Yeah, so certainly, being healthier can be correlated with higher levels of happiness. Another focus I think people wanted to shift to is um, instead of looking at life expectancy, like the age that you might die, to shift it to a focus on health expectancy, which is how many
Mm,
healthy years do we expect you to
right.
have? Yeah, and so
And I do know just that overall, people, the healthcare cost is concentrated in the last 5 years of life.
yes, yeah, yeah. So I mean that's something I don't want to like belabor it too much in my class, but I feel like I often am mentioning in class when we talk about different shifting topics, talk about new areas of like, this is the amount of money the U.S. is spending on this, on chronic illness or cardiovascular disease or whatever it is, that trying to figure out ways to have people live healthier lives is going to provide a lot of benefits. So to the person, to their families, and then on a large scale, it is better for healthcare spending. Yeah.
Yeah. Well, this has been so interesting, and I know we could just like continue on and on forever with this topic. It's so rich. Do you have any final words to leave us with?
Um, I don't think so. Other than I feel like I'm always to my students preaching: get some good physical activity, get good sleep, eat some more fruits and vegetables, and yeah, surround
Oh my,
yourself
something
with
just
people.
popped into my head.
Okay.
Something else. Outdoors,
Mhm.
right? I mean, I'm a huge believer in getting outside, taking hikes, getting into the parks, etc.
Yeah, there is research that being outside can be really beneficial for people's mental health. And then in terms of physical activity, obviously this is going to depend on the person and then where you live. So, you might have heard the term like food deserts, that some people live in
Yeah.
areas where they don't have access to a lot of healthy like foods. Similar thing of that certain people live in areas, especially if you live in inner city areas, that you might not have access to healthy places to be outside.
Right.
Yeah, so there we definitely do see some differences where not everyone has the same level of access, but yeah, certainly getting outside and doing hikes or walks, that many people find that a good way to sort of get physical activity that doesn't feel like a chore, like I'm going to have to
Right.
get this exercise in, and certainly making exercise not feel like a chore is going to help people be more inclined to continue it. Yeah, so get outside.
I never thought about it before until you just said that. But just the word treadmill, it sounds labor intensive, doesn't it?
It
It
sounds like
sounds
now
like a chore.
it sounds like it rhymes with dread. Yeah, and I would say, again, different things for different people. That's the thing too,
Yeah.
looking at like the social context and personality, that like what works well for one person is not going to maybe work well for another person in terms of health messaging or how to get them to live healthier lives. So, yeah, having to keep in mind individuals matter too.
All right. Well, great talk, Melissa. I really enjoyed it, learned a lot. So thanks so much.
Yeah, have a good day.
Bye bye. All right. I just stopped the recording.
Okay.